The advice and opinions expressed by Dr. Granpeesheh and her guests are meant solely as suggestion and should not be in any way construed as child-specific advice.
Dr. Doreen Granpeesheh is the
Dr. Doreen is an expert in autism.
Doreen Granpeesheh.
Dr. Granpeesheh.
Dr. Doreen Granpeesheh.
Dr. Doreen Granpeesheh is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen. Okay, the first question that we had written in was, my 7-year-old has been in ABA for 3 years and has made tremendous progress. I feel like the thing we are still working on is social skills. My question is, should we continue working on that in ABA, or should we move to a social skills program, or both?
That's great. So that's a good question. I'm happy to answer it. I'll try to summarize and be concise, but there's a lot to talk about when we get into social skills. So every child obviously is different, and we always have to start with what skills do they have and how can we use those skills in a social way. So in order to, let's first of all define social skills, right? So when we're talking about social skills, we're really talking about using some of our cognitive and a lot of our communication skills with others. That's what makes it social skill, right? So it's kind of like everything that we've learned in terms of how to communicate appropriately. Some of the cognitive skills, like taking the other person's perspective, understanding if the being able to tell if the other person is still interested, responding to how the other person feels. Those types of things are cognitive skills. And then, of course, social skills does often involve language and communication, which involves a lot of other, I can go into that whole area of language for a long time. And then there's, at a younger age, social skills will also include things that are play, for instance, and interacting playfully, taking turns, sharing. All of those things go into social skills. So really it's more about these content kind of like basic skills that we learn, and then learning how to use them with other people, with one other person, with a group of other people, and so on. So, just to answer this parent and any other parent who's looking at social skills, you need to learn, just like anything else, you need to learn the basic skills, but you will never be able to develop it without having practice in a social setting. So you need a little bit of both. Now, so the way that we teach is we always try to teach the content, the basic skills themselves. So let's say, greetings, eye contact, asking the other person appropriate questions, playing with toys, learning how to have empathy towards the other person, learning how to have perspective-taking skills, knowing how to resolve when a conflict arises. These are all individual lessons that have to be taught, and they should be taught. The easiest way to teach them, in my opinion, is using ABA techniques. But once you have each one of these, it's really important to generalize them to a social setting. Now, a lot of ABA providers also provide social settings. In other words, even if they have one-to-one ABA, they also have the ability to have the children come together in a group. They will have their one-to-one support, their behavior technician there to help support and prompt and model. But the goal is to bring the children together in a social type of setting, in a group setting, and help them practice. And then the next step would be, let's have play dates come over to the house. And then you still have a behavior tech there who's helping practice these skills that have already been mastered individually. And then it might even go to the level of, okay, let's actually have the behavior tech in a school setting or in some other community environment setting, like a playground or a club or gym or something where there are other children. And now the behavior tech has A, already taught the skills, B, already practiced with one other child, and now is able to practice, have our child, prompt our child, help our child practice those skills with a group of other children. It's really important to take those steps, because when we talk about just putting our children in social environments and then we expect them to just fit in, sometimes a child has already learned enough language and communication to be able to copy other children and learn from others and sort of fit in. A lot of times, what happens, unfortunately, is that our child doesn't fit in, and then they feel, either because they're not comprehending, or because everything is moving too fast, or they are disturbed by environmental sensory things, or whatever it is. And then what ends up happening is that the other children become friends and our child feels left out. So the social experience becomes a negative one. And we don't want that for our kids. We don't want our kids to ever experience feeling isolated or feeling left out, or at worst, feeling bullied, right? So we want to make sure that our children are prepared. And the way to prepare them is to teach them these skills before they are exposed to the social situation, and then to generalize and integrate into the social situation, if that makes sense.
Don't forget, you can watch Ask Dr. Doreen live every Tuesday morning at 10 a.m. Pacific time. We hope to see you there.